Welcome everyone to the StoryAidEU Module 9, which is covering collaborative storytelling. Today we'll cover 3 learning objectives and develop an understanding of collaborative practice, collaborative storytelling, and inclusive settings that foster storytelling. We'll go through the following concepts during this presentation: from IPE to collaborative practice, fundamentals of interprofessional teams, team dynamics, communication, storytelling in teams, and most of all, storytelling that includes the patient. For the purpose of the rest of this lesson, we will first go over a recap of what storytelling is. Storytelling is a holistic and culturally co-created experience which authentically navigates and engages human beings in a dynamic process of sharing, learning, and celebrating our interconnected lives. There are 4 defining attributes of storytelling which you've come across in other modules, and we would encourage you to pause and reflect on those once again. Now we have reviewed this, we can discuss our first topic, which is IPE to collaborative practice. So, what is collaborative practice? A collaborative practice-ready workforce is a specific way of describing healthcare workers who have received effective training in interprofessional education. That's from the WHO. This process relies on interprofessional teams working together with multiple other stakeholders in the healthcare process. Collaborative practice occurs when multiple health workers from different professional backgrounds work together in teams with patients, families, and carers to deliver the highest quality of care. Crucially, it allows healthcare workers to engage with any individuals whose skills can be used to help achieve healthcare goals. All aspects of collaborative practice should impact on healthcare professionals' core competencies, including transversal or soft skills such as communication, patient engagement, intercultural understanding, and patient safety. But why is collaborative practice so important? If one uses effective collaborative practice, it can lead to improved access to healthcare interventions and improved coordination of care. It can provide a comprehensive, coordinated, and safe healthcare system, make use of efficient resources, reduce incidence and prevalence of illness, and increase job satisfaction with reduced stress, burnout of healthcare professionals. Picture this: an attending physician on ward rounds enters a hospital room with a team of medical students and asks his patient this question: how can we do a better job of caring for you? The patient, a young 15-year-old boy, has been in and out of hospital 30 or 40 times for treatment for short bowel syndrome, a condition where nutrients are not absorbed properly and commonly requires surgical removal of the small intestine. This patient, who's a veteran of the healthcare system, says he's been very happy with the care he has received over the years. But when pressed, says, I have great doctors and nurses here, but can you please talk to each other? This small anecdote is a simple depiction of the importance of collaboration. Next, we will look at interprofessional teams and the fundamentals of those, values and ethics for interprofessional practice, roles and responsibilities for collaborative practice, interprofessional communication and engagement, interprofessional teamwork, and team-based care. Now that we know the fundamentals of interprofessional teams, how do we communicate with them? First, let's look at some background to healthcare communication. Effective communication within teams of healthcare professionals and between patients and carers is crucial for the functioning of any healthcare system. Good communication can reduce readmission rates, enhance understanding of treatment options, improve adherence to treatment, reduce costs related to impacts, and create overall positive outcomes for the patient. But what are the challenges? Healthcare communication attracts little attention in healthcare education, especially during formal training. Students' communication skills can deteriorate after training, and teaching these skills is neglected due to workload and clinical work commitments. Communication skills of busy healthcare professionals are often underdeveloped. We can also define communication as Healthcare communication is the study and use of communication strategies to inform and influence decisions and actions to improve health. So, what are some of the communication basics? Empathy, mutuality, and respect, inclusiveness, harmonized goals, supportive environments, transparency, continuous learning, accurate information. All of these are some of the basics. Traditional communication techniques include various tools like DATAS and SBAR, which you can go away and look at in your own time. However, why is communication not always as easy as those tools sometimes make it sound? There are many challenges to communication in teams, such as race, culture, gender, time constraints, language barriers, and many, many more. Now we will see how we can transition from communicating to storytelling. Stories convey values and emotions that can reveal the differences and similarities between people's experiences. The storytelling relationship involves a type of listening and engagement that is different to that of a performer, audience, or interviewer participant. It is a relationship that brings the divide between the person and those providing support and helps to bridge that divide. Storytelling has the potential to gain access to the complexity of both individual and shared realities in a way that other methods struggle to achieve. One can also think of the journey from story to service improvement, which highlights that a story leads to reflection rather than just dialogue, and also includes empathy with the patient-centered care. Now, if we look at collaborative storytelling, IPE modifies the attitudes and perspectives of healthcare professionals by exposing them to 3 levels of interaction: communication, mutual respect/trust, and teamwork. In collaborations involving multiple disciplines, this interprofessionality leads to multiple healing stories for both patient, healthcare staff, and their loved ones. Storytelling promotes collaborative practice and goes beyond traditional team-based communication techniques. The real difference is that storytelling includes the true voice of patients, carers, and other stakeholders in the healthcare process. There is another crucial member of the team that can be involved in storytelling, and that is the patient. Patient-led stories include patients and service users that are a rich source of healthcare-related stories that can affect change and benefit clinical practice. Patient storytelling can benefit teams by depersonalizing patient critique, exploration of knowledge creation and transfer, and also by increasing staff awareness of their own positioning within a healthcare discourse and also within the healthcare setting in general. Finally, we can finish with examples of patient-led storytelling. We encourage you to pause the video here and reflect on these examples. To conclude, interprofessional teams which work across disciplines and with patients and families are the heart of collaborative practice. Effective interprofessional collaboration requires high-quality communication techniques. Collaborative storytelling is a highly valuable tool for successful interprofessional teams. It enables the true voice of patients, healthcare professionals, and other stakeholders to be central to the delivery of healthcare.